This community forum has been organized with the sponsorship of PrEP Bakersfield, Bakersfield AIDS Project, Bakersfield LGBTQ, and the Gay and Lesbian Center of Bakersfield. With these organizations working in concert with the health department and other governmental agencies, we're going to be able to reduce new HIV infections in our community. That's the most important thing, is to work together. So, I'd like to thank Bakersfield LGBTQ for getting this venue, the comfortable seating and everything. So thanks to Bakersfield LGBTQ for that. I read 3 blogs a day religiously, and about a year and a half ago, I kept reading about PrEP and Truvada and HIV, and I just scrolled through, and I didn't pay attention. I thought, yeah, we've been hearing that for 30 years. And for some reason, I clicked on the headline, and I read it, and I couldn't believe what I was reading. Why aren't we dancing in the streets? You know, if this was in the 1980s or 90s, we would have been dancing. This was the answer to our prayers. But for some reason, whatever reason, it didn't make the news. People still don't know about it, and I can't figure it out. Let me put it in perspective. About 14, 15 years ago, a medication was developed to help men with erectile dysfunction. And it made headlines all over. It made all the national news. It made all the local news. And for 14 years, they haven't shut up about it. And as far as I know, nobody's ever died from not getting an erection. And you know, here we are with a virus that's killed 25 to 30 million people worldwide. 50,000 people for the last 10 years are infected every year. 50,000, 47, 50,000, right around. 100 to 150 people a year are new HIV diagnosis right here in Kern County. So I don't get it. I don't understand it. Here we have a preventive medication that prevents a virus that one of the most deadly viruses that mankind has ever encountered, and nobody's talking about it. I don't get it. And that's why I wanted to organize this community forum.
When Robert first started talking to me about PrEP, I was kind of like not really sure about what he was discussing, because I really hadn't heard anything in any other ways, not through Facebook, not on Google, not in advisory board minutes, not in the newspaper, and so I wasn't really sure about what he was talking about. So, but he asked me a couple of times, and so then I started looking at it, and I called the health department to ask, and then they asked, and so anyway, long story short, after about 4 to 6 months, here we are, and I'm very thankful for it. We are very blessed here in Kern County to have this evening, to have this dialogue, because I think it was just maybe a couple of weeks ago where in San Francisco they were sharing some information with the mayor was there discussing it, and then I've also seen on Cleve Jones' feed. So this is very new. It's new to us. It may be 2 to 4 years ago for other areas, but as far as getting the word out, it's still very, very new. And so I'm really thankful to be able to be part of this evening and to have Bakersfield AIDS Project helping to sponsor, and then of course standing alongside of Bakersfield LGBTQ and PFLAG is amazing, as well as the Gay and Lesbian Center. So as we are here tonight to learn more, and I look out there, I see so many of you that are like me 20 years ago when we first started talking about AIDS. And it was so hard because we knew there was not a cure. And it was just the human element of HIV. And that's what I always look at. Not the numbers, not the statistics, but the people, the humanity behind the statistics. And so for me, today is about hope. And as we've been seeing the drugs for treatment for our persons who are positive and they're living longer, that's just absolutely amazing. And it's also bittersweet when I think about the number of people that didn't have the opportunity to have those medications. But isn't it exciting to be gathered here tonight to be talking about prevention for HIV-negative people, right? That deserves a round of applause. That deserves a round of applause. So I look forward to hearing more information, and I look forward to hearing the stories and listening to the doctor, and also listening to Mr. Leather, and listening to you, because collectively, this is how we deal with issues such as these. And so thank you, and I also want to recognize Claudia here also from the health department. Will you please stand? And I just want to, say how thankful we are to have you alongside of us. So let's not forget about the people. Thank you for being here, and let's find out what we need to know and get the word out.
On behalf of Bakersfield LGBTQ, first of all, I want to say how pleased I am to see so many people here tonight. You're going to be the acolytes for this movement to bring change to our world. If you're of a certain age, you remember when AIDS first came, and you remember the stigma, and they called it a gay disease, and then they called it the gay and drug addict disease. So it didn't matter that they weren't really reaching out to people, that our government turned its back on people who were suffering. The LGBT community is mobilized, and thank God for that. But the rest of the world seemed to think that, in the words of those unenlightened, that this was somehow deserved, that we asked for this. We didn't. And there's a certain amount of anger that's been seething underneath our skin ever since. Though things have changed some, there's still a lot of people out there in the world who stigmatize AIDS, stereotype AIDS, and they turn it into something that we don't have to care about that, because it's just the gays, and it's just in Africa, and we don't care about those people. And if you don't mind my saying, that pisses me off. What shocks me is how we could have a drug that prevents AIDS, and that is not in big neon signs all over America, that is not headline news in the New York Times, that we're not hearing about this from every quarter, that you're not sick of hearing about it on Facebook from somebody besides Robert. This should be something that everyone is talking about, everyone is passing the word, that when you go to work tomorrow, you say to the people at the water cooler, hey, have you heard about this? Because we know that AIDS is not a gay disease, or it's just in Africa. It affects everyone equally. If a person is sexually active, they're at risk. So we need to stop this idea that the only people we need to worry about are our gay brothers. We need to worry about everyone. And secondly, we have to push for people to continue to speak out, for our elected officials to care about this issue, enough to fund it, enough to make it possible for people to be able to afford to get this drug without necessarily having to spend thousands of dollars out of their own pocket. Yesterday, Channel 17 ran a thing saying that Kern County was 11th in the state in HIV. And I have to say, from the coverage that I saw, I was a little disappointed that out of all the things that were said this week about HIV, that is what they chose to put in their headline. And in the coverage that I saw, very little about what this meeting tonight is all about. So we will also be chasing after our press representatives. See all the incredible TV cameras in the back? The radio reporters?
LA Times is here.
LA Times, where are you? LA Times? Thank you. Thank you. But why do they have to come from LA? So we have to push. I love LA, don't get me wrong. Our local media should be here. And they should be the ones who go back to their news stations tonight, and this is the top story We're going to save not hundreds of lives, not thousands of lives, but millions of people. But if it depends on, gee, you knew somebody who heard about it from somebody, it's going to take forever. And in the meantime, people are still getting infected. And people are hearing myths, even if they know something about this new drug. They're hearing all kinds of myths. So thank you for coming out tonight, to be educated, to learn about this new opportunity we have to change the world. But we have to become preachers. People have to get sick of hearing about it from us. Get the t-shirt, get the tattoo, whatever you have to do. Spread the word. Because if we don't, who is? Except the LA Times. Thank you.
The health department is here, and that's great. Thank you, Denise Smith. But they can think this is the best thing in the world, but they can't do anything about it unless they get the funding. And they have to go to their bosses, and their bosses are elected by us. So the next time you see a politician show up on your doorstep asking for your vote, ask them what they're going to do to create access to their clientele for PrEP. And then if they look at you like you're speaking Martian, then educate them about PrEP.